Good morning. On Saturday, I met the Navy medical team that's working at Christian Hospital for the next month. Our healthcare workers have been overwhelmed by this persistent virus, seeing day after day the toll of COVID-19. These added resources will offer relief to hospital workers and ensure patients continue to get the vital attention they need for all aspects of care. I appreciate the work of the Pandemic Task Force, FEMA, Governor Parson, and Congresswoman Bush for their work on getting healthcare workers this assistance. The persistence of the virus has been surprising for most of us. With each surge comes an eventual decline in cases, a bit of relief in emergency rooms and ICUs, and a glimmer of hope. Then another variant comes along. That happened most recently with the Omicron variant. It spread quickly and resulted in a record number of cases and hospitalizations. As a result, the County Council on January 4th approved Dr. Khan's request for a public health order on wearing masks. And school districts that were making face coverings optional put mandates in place. These actions 4 weeks ago, along with the continued slow but steady increase in vaccinations, are helping stem the spread. While numbers remain incredibly high, we appear to have seen the peak of the Omicron variant in St. Louis County. On January 4th, the day the council voted for the mask mandate, the county was seeing an average of 2,347 cases per day. 2 weeks later, the number was at 1,776. Today, the number has dipped to 963 cases per day. It's good to see that number below 1,000. However, we're still at record numbers. And these numbers were record highs back in November of 2020, and nowhere close to where we were as recently as 2 months ago, when the cases were averaging about 420 per day. While numbers are getting a bit better in urban areas, rural areas continue to struggle. And that's alarming for a couple of reasons. Where the cases are jumping, vaccination rates are doggedly low. And it's the unvaccinated who are filling up most hospital beds. A jump in cases in our less populated counties across the state affects hospitals in our region that are equipped with ICUs and the critical care skills and equipment needed to treat a very sick COVID-19 patient. Our hospitals continue to be packed and challenged by staffing issues, and that situation is not expected to change anytime soon. And that's why vaccinations are so important. With more people vaccinated, our hospitals will find a bit of relief. I'm hopeful that with our kids in the classroom, most wearing masks, and that our numbers do not begin rising again. And while another variant is likely, we're hopeful it will be less dangerous than the last. As we have seen in this pandemic, and when it began 2 years ago, the virus has a mind of its own, and it's hard to predict the impact of each variant that comes along. But we do know that mitigation efforts, if followed, will make a difference. I appreciate the pushback by school districts to the attention-grabbing lawsuits being filed against them by an office ignoring its job to protect the residents of Missouri. We all want to keep our kids in the classroom, and wearing a mask is one of the best ways to ensure that, along with vaccines. Like many of you, I pay close attention to the data that's used to identify trends and guide public health experts and leaders of our hospital systems to make life-saving decisions. A mapping system that breaks down the number of cases by zip code can be found at stlcorona.com, one of the many data points provided by the County Department of Public Health. Those living in zip codes along and south of Interstate 44 in the southern part of St. Louis County are reporting the highest percentage of cases. And that includes part of Rockwood School District, Lindbergh, Afton, Bayless, and Hancock Place. The Health Department works with our school districts on mitigation efforts and will continue monitoring closely where COVID cases are increasing, where they persist, and where they're decreasing. Countywide, the positivity rate is just under 30%. That's incredibly high. Please get tested if you have symptoms or have been in close contact with someone who has COVID. St. Louis County offers 4 drive-through testing sites, and appointments are available now at revivestl.com. Tests are free, and you don't even have to leave your vehicle. For those looking for vaccine, locations are also listed at revivestl.com. Thank you, and I'd be happy to answer any questions.
How much longer do you anticipate council meetings being virtual?
The question is about virtual council meetings, and I would just direct you back to the county council. They'll make that decision as they did in the past with the guidance of the county public health director, Dr. Com. And he has indicated that he'd like to see cases in a moderate transmission level, and we're not there yet. We can follow those trends. We have a color-coded meter available at stlcorona.com that shows the positivity rate and the number of cases per day.
So there's a big snowstorm coming. Can you talk about how the county is preparing right now?
Oh, so a question about the snowstorm. We are preparing. We're making sure that our snowplow drivers are ready to go. Checking our stockpiles, watching the weather very closely, watching for trends for it to arrive earlier than predicted or a little later than predicted. But we prepare for these snowstorms many days in advance, and our Department of Public Transportation is making plans to make sure we're doing everything possible to keep the roads clear.
What should people do if they need a COVID test or they have an appointment for a COVID test and then the snow gets really bad?
Well, so the question is about how the weather might interfere with someone's ability to get a COVID test. I guess that's a reality. We'll do our best to keep the roads clear, but sometimes the weather can overwhelm us, and it will certainly impact our access to health care, whether it's COVID testing or vaccines or otherwise. If you miss your appointment, then make another one. We saw a couple of weeks ago some of the state testing sites canceled their locations because of inclement weather, and I would encourage everyone to watch the news for any updates about changes in scheduling based on weather patterns.
What has the demand for testing been like? I think a few weeks ago we were seeing most of the appointments being booked through the week. Is that still the same level of demand we're seeing, or has that dropped off at all?
The question is about the demand for testing. It's eased a little bit. There's still a significant demand there, but if you call and try to get an appointment with any of the testing locations in town, you should be able to get an appointment within a day or so, and that's on average what's happening. We also know that the home tests are now becoming available. The new site by the federal government is up and running, and people are ordering tests, and those have started to arrive and will be available to folks who want to do home testing. And we expect to see the supply of home tests increase. We expect to see more home testing, and we've seen a little bit of an ease in lines to get the traditional PCR tests.
I just had another question on a different subject on the property access clean energy loan program. The council at one point was considering disbanding the program because of some concerns. Now they're considering expanding it, some new added protections. Where do you stand on that? Do you support joining the Missouri Clean Energy District and continuing those loans?
So the question is about the PACE program, Property Assessment for Clean Energy, and this is a program that allows people who make energy-saving improvements to their home to capture that savings in utility bills and reinvestment in that energy upgrade. And my concerns in the past have been around consumer protections. We've seen a lot of information in the past couple of years about those concerns. When this program was passed 10 years ago, we didn't see that piece coming. The council and their discussion has been mainly around making sure that those consumer protections are available and in place. There was a state law that was passed last year that increases consumer protections in Missouri. And if the council passes a bill to keep PACE programs going in Missouri and recognizes a need for consumer protections, then I would support that. Any questions?
Thank you.
Okay, thanks.